Our second area, and I believe me can talk for hours on each one of these, but establishing um, biological integrity, if you will, or really what I would today call the extracellular environment, getting that microenvironment optimized. You probably appreciate seed and soil. Seed and soils existed since discussions back in the Ming Dynasty, dates back thousands of years. But I think I was among the very first to put laboratory tests and a full treatment system in place to transform what I called back in the 1970s and early 80s the biochemical and metabolic terrain. It would take 20 plus years for the pharma research oncology community to refer to it as the tumor microenvironment. But we were talking very similar with regards to things like inflammation, oxidation, glycemia, hyperinsulinemia, immune suppression, or depression, and stress chemistry, coagulopathy. Take coagulopathy. I kind of get some of you scratching your head saying, who? Coagulopathy is stickiness, blood clotting. And we know that the challenges of cancer, usually patients do not succumb from malignancy at all. In fact, it's a very rare event, but rather from complications, life-threatening complications. An example of that is blood clots that turn into moving thrombi and emboli. And so from a challenge perspective, it's really relevant to deactivate and deaggregate platelets. Well, your platelets are there to create clots. But believe it or not, your platelets, I refer to them as drills and shields. They will drill a hole from the basement membrane. Think of the basement of your house, and that you need to get into the water and gas lines. But in this case, I'm going to refer to it as the rivers of the body, your blood and lymph system. And cancer cells want to spread, and they do that by activating platelets to drill a hole. And now the cancer cells can migrate from that basement membrane into the rivers of the body. And the platelets come with them, and what the platelets then do is they act as a shield, and they actually will wall off, kind of creating, a wall around the cancer cells. And now the cancer cell can migrate through the system, find a new place to dock, and now, I guess we would use the word in science, extravate. They would actually leave the vessel and now enter tissue and find a new home. And that's how metastatic sites develop. And yet, if we give the right diet, the right control of stresses, we sleep well, we stay optimally fit, we take the right compounds, we can deactivate and deaggregate platelets, first making it harder for those cells to ever breach into the rivers of the body, and second, so that the platelets don't act as a shield, leaving the cells that do make it into the rivers of the body exposed and thus far more vulnerable in terms of cancer killing effects from one's immune system and various lymphocytes and white blood cells and natural killer cells. So there's real evidence in varieties of ways, and I can even maybe through the talk give you some patient examples where getting the soup, if you will, this terrain, this microenvironment, so it is inhospitable to cancer instead of supporting cancer. And what happens is the cancer cells and the cancer tumors will hijack the terrain for their own purposes. As a patient, we have to hijack that back And so we do laboratory testing, very extensive laboratory testing, and we let a patient's targets tell us what to do to fix that environment so it's cancer fighting instead of cancer promoting.